So thank you everyone for joining us this evening, and we're going to spend the next 2 hours talking about a new model, a new way of thinking about chronic pain. I welcome everybody here, but I also welcome everybody on our Facebook audience. We're not going to be able to take questions from the Facebook audience this evening, but if you do have them, please don't hesitate to contact the office with any concerns that you may have. We're going to cover a lot today, but I just want to first introduce those of you who are not familiar with the Kaplan Center. We've been around a long time. We were the first integrative medical center in the Washington, D.C. area, and we were established in 1985. We're a teaching affiliate of Georgetown University Medical School and have been affiliated with Georgetown since we opened up. We were one of the centers we were the center actually that helped establish the integrative medicine training program at Georgetown, and we proudly continue to affiliate with that program as well as the undergraduate medical program. It takes a team, okay? You can't do this kind of work without a team. And we are blessed to have a number of very talented physicians and physical therapists and nutritionists in order to make this thing work. And counselors, you just can't make this work without a team. And this is part of our team. The physicians in the center are board certified in family medicine, in pain medicine, and in physical medicine and rehab. We have physical therapists on staff, specializing also in chronic pain, who do a lot of work with craniosacral work, do work with pelvic floor disease. And so we bring together a lot of very talented and very gifted people in order to make all of this work. It also works uniquely when we're working under one roof. It facilitates communication. We have meetings in the center every other week with all of the providers, that is people who are putting hands on patients, so that we can exchange information so that we can optimize the care of the patients that we're seeing in the center. We have acupuncturists on staff, psychotherapists, nutritionists, meditation and yoga teacher, and that's incorporated as part of our work here, as well as massage lymphatic drainage. All of these different therapies are necessary at different times in patients' treatment, and all of them integrate together. It's about the coordination of them, not simply doing them individually and spread out without any connection between how the providers are working. So this is very much a team approach. In order to get people better, it takes teamwork. We provide a lot of different services at the center. Okay, so psychotherapy, our psychotherapist is specifically trained in doing a lot of trauma work and incorporates techniques such as EMDR, but she also does a lot of work in terms of relaxation and stress management, utilizing techniques such as heart math, physical therapy, integrative therapies. We use acupuncture, we use OMT and craniosacral work. Regenerative medicine, okay, is a very big part of what we do. This is utilizing techniques such as platelet-rich plasma, stem cells, and hypertonic glucose in order to help regenerate ligaments and tendons and some cartilage growth. Meditation and yoga. Peripheral nerve therapy is a technique that was developed by John Liftoff. It's a way of treating peripheral nerve damage. It can be highly effective for people who have not had results with other therapies. Functional medicine and testing therapies. We do a lot of nutritional counseling. We use a lot of supplements and herbal therapies, lymphatic drainage, chelation therapy, as well as other IV therapies. The point I want to make with this slide is, from my standpoint, this is the medicine of the future. It's about combining very conventional medical techniques along with functional medicine techniques and other complementary therapies. It's the integration of these that really results in a very powerful, dynamic, and ultimately, for many patients, finding answers that they were unable to find anywhere else. When we've got a lot of tools, it teaches us to ask a lot of different questions. It gives us a lot of different perspectives on things, and it helps us get more insight into what's going on with people and how to make them better. A.T. Still is the founder of the osteopathic profession, which was founded in the late 1800s. A.T. Still argued that to find health should be the object of the doctor, because anyone can find disease. Unfortunately, we spend way too much time looking at disease and not enough time looking at health. The other thing that we've really missed in the West and we need to get back to, as Still said, I want to understand that I look upon the treating of effects as being as unwarranted as it would be for the fireman of a city to fight the smoke and pay no attention to the cause that produces it. With chronic pain, we spend $625 billion a year failing at treating pain. We have created an opioid epidemic where 17,000 people a year are dying. Because we're treating the smoke, we ain't treating the fire. And today's lecture is about what's the fire. So what we're hoping to accomplish in the next couple of hours is we're going to redefine chronic pain and major depressive disorders as symptoms, not diseases unto themselves, but symptoms of an underlying inflammation of the brain, a neuroinflammatory process. We're going to discuss the relationship between both our brains, the gut and our brain, because the gut-brain axis controls a huge amount of how we process information and whether or not our brains are healthy or sick if our guts are not healthy. We're going to look at creating a map of the neurophysiology and neuroinflammation that will help guide us in our diagnosis and treatment of individuals suffering with pain, chronic pain and depression. We don't have a map, we don't know where we're going. We have to know what the underlying physiology is because that will guide our questions and that will guide our treatments. We're going to understand why it requires that we utilize a comprehensive integrative approach for successful treatment outcomes. We're also going to review some of the specific testing and treatments involved in successfully treating neuroinflammatory disease. At its basis, the treatment of chronic pain is pretty straightforward. It's 1, identify the problems that set the brain on fire. 2, treat them. 3, once the brain has become upregulated, once there's an ongoing inflammatory process going on in the central nervous system, even though you eliminate all of the things that have created the problem, you then have to go and quiet the brain itself. And we're going to talk about this at length as well, because if you don't do this part, or if you do this part before you've done that part, you fail. So it's really crucial that we put out that fire because it's a wildfire that's continuing to burn in the brain, even though we've eliminated the things that started the problem. You have to think about pain as 3 different things. There's acute pain, there is chronic acute pain, and there's chronic pain. And they are 3 different things. The neurophysiology of acute pain is completely different than that of chronic pain. Chronic acute pain, where in the case of a cancer there's ongoing destruction of tissue, or in the case of a herniated disc where certain movements create the pain and then the pain goes away for periods of time. The physiology of that is different than chronic pain, which is an ongoing, all the time kind of an issue. And we don't treat it as such. We treat everything essentially as acute pain, and we fail. We have to quit treating the symptoms, we need to treat the disease. The disease in chronic pain is inflammation in the central nervous system. Now the other issue that we're constantly arguing about in the pain field is pain, chronic pain in particular, a bottom-up or a top-down phenomena? The answer, of course, is that it's both. All right, so there's tissue damage that's going on that continues to participate in the ongoing inflammation in the central nervous system, but the inflammation in the central nervous system allows for ongoing problems with spasms and damage to the musculature and nerves. We're going to be focused throughout this time period on the top-down phenomena. This goes for a whole nother lecture.